Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to the Functional Medicine Shaping Holistic Care series. I'm your host, Dr. Candace Pierce, and back with me to continue this discussion is Leah Gagan. Leah, thank you for continuing this discussion with us.
Yeah, you're welcome. This has been fun.
Yes, I've really enjoyed our conversation thus far. And to our listeners, if you missed episode 1, I really encourage you to check it out because Leah really emphasized the importance of addressing root causes and how that leads to improved health outcomes. So in this episode, we're going to focus a little bit more on the preventative care, some essential roles that nurses could play in functional medicine, and integrative approaches that we've seen in functional medicine. Now, we already know how nurses play a crucial role in managing and coordinating care, and that their collaboration with other healthcare professionals is vital for enhancing patient outcomes. So Leah, I want to start with case management because that's a huge role for nurses in general.
Absolutely. And it's so essential for patient compliance, support, and basically just making sure that an entire healthcare team is really integrated and communicating with one another. And especially in functional care, I think that has tremendous value because change is hard.
It is very hard.
You can feel so excited during an appointment to making change and motivated, but when you're home and you're in your environment trying to implement those changes, you can get stuck at times. So having an infrastructure where you have people to reach out to, whether that is a nurse, a social worker, or a nurse practitioner, having a team of people that are helping you hold that space, be accountable, and to help you troubleshoot any issues and barriers that will get in your way of implementing a treatment plan can be very helpful.
So what does that look like in functional medicine? How does that case management, how does it look to improve your patient adherence?
Yeah, great question. So typically the way that that looks for my current practice is I give people very detailed treatment plans and I go over exactly what the next steps are. So here's the testing you need to get done. Here are the supplements or medications you're taking, and including in that note why they're taking it. Because even if they remember it in the moment for the visit, being able to re-reference those notes afterwards will be very helpful. I also will record oftentimes my initial follow-up with patients where we're really integrating the test results into a treatment plan for them so that if, again, they really want to re-listen to it and better understand what we discussed, they have the ability to do so. And then there's really close follow-up afterwards. So typically a month after their initial appointment, somebody from my office will check in and see how they're doing, see if they need any support anywhere, if anything's unclear. And I think those touch points, making yourself more present in somebody's life as they're going through these interventions can be incredibly helpful. And that also is very different than I think conventional care because most people will often just go to their healthcare provider when they're sick, or maybe just once for their annual physical exam. And it's a retraining of how people engage in the healthcare system to teach them to be more proactive of, no, you should be touching base with your provider multiple times a year, even when you're not sick, to prevent yourself from being ill. So changing that mindset through showing patients the model of how we want them to engage with us can be very helpful.
I love how you said you record one of your visits, and it really took me back to when I met with the functional medicine, and they were looking at all of those labs that they drew, and she's circling and like drawing lines and saying this goes into that. And I know what each lab means by itself, but you're not really taught that functional medicine look at this goes into this and goes into that. And so I was very confused when I got home. I couldn't regurgitate what she just told me about how all the labs affect, this did this did that. And I was like, I don't know. So having that recording, I think is so beneficial. I love that you do that.
Thank you. Yeah, and you're a doctor-prepared nurse, and it was hard for you to
Yeah.
digest. Imagine what it's like for some patients who don't have that experience in healthcare. I'm constantly reminding myself of that, of how
Mhm.
can we make this information as easy to understand as possible, and not overwhelming to somebody? Because most people's initial inclination when they don't understand something is to kind of shut down. Uh,
Hmm.
or to look inward at themselves and be like, oh, why aren't I getting this? She's making it sound easy, but I don't understand. And that is not a good foundation to empower somebody to care for themselves. So, and a lot of that also is just trying to figure out what tools and what way somebody learns best. And part of my initial evaluation with patients, on top of going over their healthcare, is to actually ask them, like, okay, on the spectrum of wanting to know absolutely everything on your test to just telling you what to do, where do you fall? Like, what is the best way for you to learn information? Are you visual? Do I give you YouTube videos? Do I give you podcasts?
Hmm.
Do you like handouts? Do I color coordinate, my notes for you? So there's a lot of that intake too, just to, again, make sure that patients are able to follow the complex treatment plans that we're enacting. And as a provider too, taking that extra time up front often saves us a lot of time on the back end with clarifying questions and confusion or follow-up appointments to revisit a treatment plan, because we took that time to really make sure that everything is organized up front.
So you don't know what you don't know until you sit down and you analyze all the tests and that is the assessments of the patient. So becoming overwhelmed as a patient, how often do your patients look at you with the huge eyes and in that initial where you're breaking everything down?
It does happen sometimes for sure. But I think also checking in with patients throughout the appointment, allowing that space to be like, how are you feeling? Is the pace that we're going through this okay? Do you have any questions? Just allowing that space for a patient can be really helpful. Instead of just waiting to the end to have them ask questions or to just summarize everything, I notice breaking things up into chunks can be a lot helpful. Especially knowing that an appointment's an hour long, sitting down
Mhm.
and talking to somebody for that amount of time requires a lot of attention. So I think breaking it up in that way can also help people stay engaged.
What does collaboration in functional medicine look like?
Collaboration is so important for functional medicine care and healthcare in general. And that's something that I think nurses really can play an integral role in. Nurses, just in general, are so uh, well suited for functional medicine care, because beyond just understanding the pathophysiology of disease and
Mhm.
critical thinking, we really learn about family dynamics and emotional and spiritual needs of patients. And for many patient nurses who have come from bedside nursing to transition to an NP role or outpatient care, we're used to spending a lot of time with patients and their care providers. And through just being present during those things, having emotional intelligence, I think nurses are able to really understand the whole person in a very intimate way beyond what other healthcare providers are able to deliver. And in that way, it can be really special to have them transition into functional medicine care, because it's almost just an extension of the way that we've already been trained under the nursing model
Mhm.
of care. Um, and that's really essential too, having those communication skills, because too often, I think conventionally, specialists, primary care providers, social workers, therapists, we all kind of operate in our own separate silos, and people don't often communicate. Treatment plans that you're doing with a patient
Right.
to their other practitioners. And I've witnessed personally how that can be incredibly confounding and stressful for patients, to have to be that translator of treatment plans from one provider to the next. Or how do they navigate conflicting information? If their GI specialist is telling them to take a medication and I'm telling them why they shouldn't,
Mhm.
where does that leave them? with these two providers that they trust, how do they move forward with that? So having that interdisciplinary team, having people with different skill sets and training that have mutual respect for each other, communicating in the betterment of patients, and allowing their egos also to take a step back and just
Right.
realize,
Yes.
I'm not going to be the expert of everything. And it is not a weakness for me to reach out to other people to better understand areas of medicine that I am not an expert in the betterment of my patients' outcomes. And
Right.
I think nurses do a really great job at that, being humble and reaching out for help when we need it, because we have always functioned in a team dynamic in a really empowering way.
So when you're talking about interdisciplinary practice, do you find that as being specialized in functional medicine that you're accepted in mainstream medicine when you reach out, or that they're willing to collaborate, or what does that look like right now?
It really depends. It depends upon the practitioner. And I always pride myself on being a forever student and being open and curious to new information. And that's part of what makes healthcare so dynamic and exciting to be a part of, because even 5 years ago, we were practicing and we have different policies than, at that time. Even just screenings to be proactive with things like mammograms for breast cancer,
Right.
those interventions were changed. Um, and unfortunately, I found that not all providers are as open and curious to alternative forms of healing, even if they're not able to offer anything more to their patients,
Mhm.
that they've reached a standstill, that they're kind of stuck. It can be hard for them to be open to different testing or different thought processes than what they've been trained in. And it again can be a little tricky being in a more like new age form of medicine to
Right.
engage with some of those more traditionally minded practitioners. But I found over time that there is a law of positive attraction. And if you bring out an energy of curiosity and respect, then you will actually attract other like minded and hearted professionals to collaborate with. And that's part of how you build your professional network. Over time and through building relationships, you have your go to therapist, your go to GI specialist,
Mhm.
your go to rheumatologist that you have good rapport with, and that respects your opinions and is willing to take calls with you, because again, ultimately that just benefits your patients better and makes them feel really cared for and held.
Absolutely. And I'm starting to see more and more that functional medicine is becoming um, a choice where people are actually looking into it, going there. But I see what you see, that bias of I'm not into that. I wasn't taught that way, so I'm not interested. So hopefully, as this continues to grow and we see successes, patient outcome stories that can be shared, this will bring about more curiosity.
That's exactly it, Candace. Absolutely. And although the pandemic brought a lot of tension and discomfort and stress to healthcare practitioners that many are still recovering from, I think there's also been a really beautiful silver lining of some of the flaws in the healthcare system that were illuminated through the pandemic. Both for nurses realizing, oh, wow, I really wasn't very supported in that environment. And I wasn't really cared for as much as I want to be as a valued member of this team, where they're looking elsewhere for positions that really make them feel empowered and supported. But then also as patients, oh, wow, so maybe taking a medication for something is not always the solution. Maybe there is another way to care for my health, or be more proactive at supporting my immune system so that I'm not vulnerable to some of these scary side effects of something like COVID. So I have noticed that there's a renewed sense of interest both from patients as well as practitioners in this field of medicine, most acutely over the past 4 years. And I had already been in the field prior to the pandemic, so it was really special for me to witness and be a part of catching that wave and seeing that shift. And I'm a huge believer in the fact that there's more patients than
Mhm.
providers that need this type of medicine, and I want to get more people into this field. who are good-hearted and supportive and want to deliver this type of care. I want to really be somebody that can help support other nurses on this path if that's what they choose.
Absolutely. And we have to find a way to have alternative choices that are covered by insurances because they should be. If we know that they work, we have the evidence to show that they work, then that should be an option. It shouldn't always just be medications and surgeries. If there's an alternate means that actually works and we have evidence to show it, why is it not covered so that other patients can benefit from it?
Absolutely, Candace. And it's exciting if anybody listening to this is really interested in the research behind functional medicine and care outcomes. Cleveland Clinic is one of the forefront research institutes that are doing a lot of studies on functional medicine care. And they've actually released two papers to date. One that's showing how functional medicine care can help improve patient outcomes long term and improve cost effectiveness of care, specifically for insurance companies, which again, ultimately,
Yeah.
it does come down to money in our care system, unfortunately. So having that
Hmm.
type of data to support functional care is incredible. And then they also have a new study too that shows the power of community and how we have a loneliness epidemic here in the United States. And by having shared medical appointments where people who have similar health conditions can talk and feel supported by other people who are dealing with that same issue, how that also can drive positive outcomes and cost effectiveness, especially under this umbrella of functional care. So, definitely
Yes,
something to keep an eye on as studies continue to come out.
absolutely. Can you give an example of how this integrative approach has successfully prevented chronic conditions?
Absolutely. So, in addition to digestive health, one of the main areas that I help patients supportively with are hormone balancing throughout the
Mm,
lifespan. So, women who are cycling and having issues with fertility, PCOS, uncomfortable periods. But I
mhm.
feel like one subset of ladies who often do not get proper education and care are perimenopausal women, which are women within the 5 to 7 years prior to them not getting their period anymore, who start to go through hormonal shifts and changes. We've all heard of them, right? Hot flashes, night
Yes.
sweats, mood swings. Um, and of course, even though those symptoms are uncomfortable, there are also a lot of diseases that women are more vulnerable to as they enter into perimenopause and menopause. When women stop getting their period and estrogen is no longer at higher levels in the body, we're more at risk for cardiovascular disease. We're more at risk for osteoporosis.
Mhm.
We're more at risk for dementia and issues with memory. And typically, the way that I work with patients is trying to understand and address hormone fluctuations during perimenopause using natural treatments, as well as maybe bioidentical hormones to help keep hormones balanced as they transition into menopause. Not only helps them with symptom management, but actually will help prevent some of those illnesses from developing.
That is so interesting. So, do you work with other physicians, other care providers in that care with the perimenopause, menopause women?
So it really depends. I do have the training and expertise to manage those patients on my own. But
Hmm.
oftentimes, especially if somebody already is on the spectrum of disease where they maybe have some osteopenia or osteoporosis, I will work in conjunction with endocrinologists or OBGYNs to continue to monitor people. And interestingly, too, there's been a lot of new data out on actually using hormone replacement therapy in very specific subsets of women who have had breast cancer previously and are in remission,
Hmm.
and
Hmm.
how giving them hormone replacement therapy can actually help prevent cancer reoccurrence, which
Really?
goes against some of the early studies on
It
hormone replacement
does.
therapy. And in those cases, just knowing their history and everything, I feel more comfortable working within the team dynamic to make sure that we are giving them the minimum amount of hormones that they
Hmm.
need to optimize their health and that they're being screened properly to ensure that things are safe. Um,
Yes, that's really interesting. When I was in nursing school, I worked at a pharmacy and we actually compounded hormones. Like the provider would communicate with the pharmacist and he would compound whatever hormones he was asking for, the strength. So you could like rub it on, or it was even pills. We compounded pills. So I remember a lot of back and forth trying to figure out dosages.
Wow, that's so great that you had that experience. Yeah, functional medicine, we do use a lot of compounding pharmacies to, again, just deliver
Hmm.
that personalized approach to care. I'll even use it for things like thyroid imbalances for patients. If they're in between two doses of levothyroxine or NP
Oh, yeah.
thyroid, you can actually create custom doses for people and ensure that those medications don't have fillers or any additives in them. So it really is a useful tool.
Absolutely. I know, sometimes they'll even compound some of the GLP-1 meds.
Yes, yes, I have seen that as well, and there is a little bit of controversy around that too, of whether or
Mhm.
not they actually function as well as some of the prescription strength ones. I think we're still kinda in the Wild West on how to navigate,
Absolutely.
some of those things now, but again, it's a learning curve. It's something that instead of moving away from those things, I feel very attracted to working with, practitioners who instead of being dismissive of new things like
Mhm.
that are really
Mhm.
curious and lean in and go to extra talks, speak to pharmacists about it so that we just get more clarity.
Absolutely, and it really lends to that patient-centered approach, personalized care. Not only personalizing, what you're doing with them and assessing them and really looking at the big picture, but also then bringing in pharmacists and other providers who can lean in and learn from each other and really personalize the care that that patient receives. That's huge. I love that opportunity that functional medicine brings.
Me too.
So,
I get so excited just talking about it.
what are the main benefits of preventative care within functional medicine?
Absolutely. So there are multiple ones, but essentially, early detection of disease risk and of imbalance can help prevent disease, can help prevent adverse outcomes. And it's always easier to treat things in their early stage versus when they're in a more advanced stage.
For sure.
So that is one of the cornerstones. Um, Also, helping to teach people how their bodies work and using lifestyle as medicine when they're feeling well helps to prevent disease. One of the adages I'll share with patients a lot of the times, especially when they're interested in functional care preventatively, is if you make time for your wellness, you will not be forced to make time for your illness down the line. And I think that
Absolutely.
resonates with a lot of people of, "Oh, wow,
Yes.
like, this is an investment in myself and in my family and in my community, and, by doing this now, I'm actually saving myself time, money, stress, and issues as I age or, as I live life."
Right. This is part of self care. And I know a lot of people think self care is selfish. But if you take care of yourself now, you're going to be a better mom, a better, parent. You're going to be a better nurse. You're going to be a better practitioner. You're going to be a better friend because you're going to have the energy and the time to invest in others because you took the time to invest in your health. That's not selfish. It's not.
Not we all. And I think both from the provider and patient perspective, being really clear on your why you're choosing to do something, will help you stay rooted and aligned with your North Star as you go through these treatment plans, as you invest this time. And on the patient side, that can look like something. I have a 45-year-old patient right now who lives in the city, and his uh, his North Star is I want to be with my kids and active with my children throughout their entire lives. I want to be a present parent. I want to be able to go outside and play with them. I want to be able to move them into college without pain. I want to be the healthiest version of myself for them. And when things get tricky for him, when he keeps coming back to see me for the preventative approach to care, that is what helps him stay aligned and motivated. And for practitioners too, I mean, just really understanding the type of care you want to deliver, how you want to come across, what really matters to you in your life. These are things that I never thought I would be building my career around, but
Mhm.
having flexibility, like working with people that really make me excited, that I enjoy seeing. There are career opportunities out there that will allow you to show up and do those things that you enjoy every day. And being really clear about what you want in any given moment will help you build that future and build that career around what you are setting your sights on.
Yes. And I was just thinking about how we are role models to our children. Our children, they watch me have quiet time. They watch me work out. They watch you do these things, and they're going to role model that when they get older. They're learning from you what we do. Don't I grew up and I would hear the phrase, "Don't do what I do what I say." But no, we it's our role model is what we do. It's not what we say.
Absolutely. That's such a great point. And something else that I'll share about that as well is one of the main ways that I attract new patients to my practice are through word of mouth and through my current patients. And part of the reason why is because these patients that I'm working with go to family gatherings, they talk to their girlfriends, and people look at them and they go, "Wow, you look amazing. Like you've lost weight, your hair is shiny, like you seem really
Mhm.
happy and present." And it's through all of those like external cues and just communicating with people that they realize something has changed in someone they care about. And that is probably the best form of marketing because people can actually see these outcomes and they actually want a piece of that too. And they're already
Yes.
curious and open when they see people that they care about getting tremendous benefit from functional care. So I feel like it's this beautiful grassroots movement that has just slowly
Mhm.
been evolving. And it's wonderful
Definitely.
for the practitioners too, because if you're really clear on what type of patient you're calling in and the people that you enjoy, typically like a friend of a friend is someone that you would get along with well, just in general with like social dynamics. And it's very similar with patients. If you really love your patient population and they're referring friends and family that they're also very aligned with, you're creating this community of people that you really enjoy being a part of.
Yes. So what role do you see nurses playing in functional medicine?
Just as nurses are the backbone of the healthcare, truly our healthcare system here in the United States, we are the number one trusted profession. I can see us becoming the backbone of functional medicine care as well. But just based on the type of people who are attracted to being a nurse, the training that we get, and not just the skills and the intelligence we have on the clinical side, but the emotional intelligence that we bring to the table too, which is so foundational in working with people and building rapport, communicating with that interdisciplinary team, as we spoke about. I feel that nurses can play a really central role in this. And that can be anywhere from a nurse that's working as a case manager at a functional medicine practice, or administering IVs, or going over diet and lifestyle interventions with patients, to nurse practitioners that are doing these advanced tests and creating customized plans with their patients. And it really is one of my missions through my practice to attract other nurse practitioners who are core aligned with these values into this field because there are more than enough patients for all of us. And I want
Yes.
people to feel like they're able to transition into this field of medicine and even going further into entrepreneurship as well. That wasn't something that was really brought up to me when I was going through my training and education, but
Mhm.
it's something that has been really fulfilling to my life and building the career that I want. And I want to show people that there is a pathway to do that for themselves too, if that's something that they want to explore.
So, speaking of entrepreneurship, what advice do you have? Any advice you would give to other nurses, nurse practitioners who are interested not just in functional care, but also maybe entrepreneurship?
Yeah, absolutely. So one of the main things that I would recommend is finding the right patient fit. I know we spoke about that a little bit before, but you only have a limited amount of time and bandwidth and energy in any given day. And who you invest that time in makes a big difference in both your health as well as the outcomes for your patients. So being really clear about your locus of control, your expertise, what type of people you enjoy working with, I think is one of the most foundational things for setting yourself up for success in the field of functional medicine care. So that would be one big thing. And also just knowing your limits as a provider, like knowing
That's
what
good.
is within your control to do, knowing when something is getting too complex or when something is serious and requires a referral. I think that's one of the things I really appreciate from my emergency room experience is still having my spidey sense on when something is becoming more acute and knowing what to do in those scenarios, walking patients through that. Uh, and that I think is the most self-aware and appealing provider for me is somebody who knows their limits and knows how to work within a team for the betterment of their patients. Uh, and last but not least, this is a bit more of like a personal development recommendation, but getting really clear on your goals, your why, your North Star that we were talking about,
Mm-hmm.
really understanding what you want to get out of your career, what you want your mark to be on this profession so that you can start taking those steps towards building that career for yourself and attracting those patients that are going to help you further your skills would be my advice. Also, finally, I would recommend having a mentor. And I know that's easier said than done, but essentially somebody who has been through and somebody that you look up to who is in this field, who has training and expertise that's willing to take you under their wing and to show you, the field. And I think nurses more than any profession really understand that because part of our training is clinical hours, spending time with practitioners that are trained, just being a fly on the wall at times and seeing how they approach difficult topics, how they explain certain things. Um, just so that when you're new, you have those experiences so that you can integrate that information and then make it your own over time.
Absolutely. And I love what you said about a mentor because the knowledge, the wisdom, the experience that you get with a really good mentor is priceless. I mean, they can really help you grow tremendously.
Completely agree. We all stand on the shoulders of giants, and I would not be here today if it weren't for my family, my partner, the people who believed in me in those early stages, the
Hmm.
practitioners that took the time to train me and to be available for questions. All of that is not unseen and really has shaped my career to this stage. And it's something that I want to continue to give back to most especially the nursing community because of how
Right.
valuable it's been to my personal growth.
Yes. Well, that brings us to the end of our series, Leah. Thank you for spending this hour with me, with sharing your experience and your expertise with our learners.
Thanks so much, Candace. This was fun.
Yes, to our listeners, thank you for joining us on this podcast series. Nurses, we know, are crucial in ensuring the health and well being of patients, and that directly affects the patient's overall health outcomes and their quality of life. We hope that you have gained insights into the essential role of nurses and the benefits of integrative and preventative approaches in functional medicine. Functional medicine is definitely becoming more popular as more people really are looking for a personalized and holistic approach to healthcare and focusing on root causes of illness rather than just treating symptoms. I know I started seeing a functional medicine provider for my own health for the same reasons. It's also something I found that was particularly appealing, and that is that it emphasized patient-centered care, lifestyle modifications, and preventative measures, which for me, and I know many others, can lead to a more sustainable health outcome. For those who are looking to learn more about functional medicine, some valuable resources you could look into would include the Institute for Functional Medicine and the American Holistic Nurses Association. If you found this series helpful, please subscribe and leave us a review. And if you have not already, I encourage you to explore many of the courses that we have available on elitelearning.com to help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.